Good morning, Queensland, and good morning to all of our Facebook Live followers. So we've got a few things to get through today before I head off to National Cabinet, but the Health Minister and the Chief Health Officer are available to stay a little bit later. So we have 14,914 new cases and 2,812 positive rapid antigen tests. Now, tragically, it's a very sad duty for me to report that we have lost 6 people overnight. That is the largest number of people that Queenslanders have lost during the pandemic. Can I please express my deepest sympathies to the families of the loved ones that have passed away. These are people's grandparents, brothers, sisters, uncles, and I think this will be a very difficult time for families at the moment. Unfortunately, we are in a pandemic, but it's still a very, very sad day for these families. These 6 people who have lost their lives are aged between their 70s and their 90s, and the Chief Health Officer will give a little bit more detail. But when you think about during the whole 2 years of the pandemic, we lost 7 people. To lose 6 in one day is a big shock, and our thoughts are with the people at the moment. It's quite upsetting. Can I also mention that we have 556 people in hospital, 26 are in ICU, 10 are ventilated. The Chief Health Officer will talk a little bit more about that. We have 91.33% of people have had at least one dose, and 88.18% of people are fully vaccinated, and I'll come back to that in a moment. In good news, 795,000 people have had their boosters, so that's wonderful to see people coming out and getting that. And like I said, it is very important for people to get their boosters. That is that added layer of protection. And if I can also reiterate what I said earlier, that if you are a senior at the moment in our community, whilst we are going through this wave, and I've said this publicly, please think about limiting your movements during this particular point in time. We've also activated the Care Army, so if you are at home and you can't access certain services, the Care Army is there through the Community Recovery Hotline, and that is 1800 173 349. And our Care Army has done a mighty job over the last 2 years, and they've been stood up again. So I thank those men and women who are giving up their time to help the most vulnerable in our community. Good news, our 5 to 11-year-olds are getting vaccinated, and it's wonderful to see. In fact, speaking to young people across the Brisbane region, everyone's excited to come and tell me that they've either had their vaccine or they're booked in to get their vaccine. So that's wonderful to see that's happening as well. And of course, we've got National Cabinet starting very shortly as well, where I'm quite sure that we'll have a lot to discuss there. I want to talk to you briefly today about the 90%. So we're due to hit 90% around the end of next week. However, today I've had a conversation with the Chief Health Officer, who has advised me this morning that the situation across the East Coast in terms of Omicron cases now gives rise to some measures that I'm about to announce today. I've also spoken at length with the Police Commissioner. The Police Commissioner also advises me that some operational requirements are needed for police. So let me start by thanking all of our men and women of the police service, our emergency services, and anyone else who has worked on our borders. They have done a mighty job. During the 2 years of the pandemic, they have, and I think the Police Commissioner will give you the details, they have stopped so many vehicles, intercepted so many flights. Their job has absolutely kept Queenslanders safe. But now is the time for the barricades to come down and for the police to come home, and the police to continue about their normal operational duties on the front line as they are needed throughout the state as we face this Omicron wave. So from 1 a.m. Saturday, the borders will be coming down. So that means anyone coming domestically across into Queensland, either by road or by air, They do not have to show that they've had their border pass. They don't have to show that they have state that they've had a RAT test, a rapid antigen test. But this is the time, and the time is now right as we head towards hitting that 90% next week. In terms of international travel, we will wait until that is formally declared on the 90%, but we need to take this step today, and I think every Queenslander wants to thank the men and women, especially our police service, that have done a great job, and the Police Commissioner will comment a little bit more about that. So with that, I'll hand over to the Chief Health Officer and then the Health Minister and the Police Commissioner.
So we have, unfortunately, 6 deaths to report today. 2 people in their 70s, 3 in their 80s, and 1 over the age of 90. All had significant underlying medical conditions. 3 of them were in residential aged care. 5 of them were double vaccinated. 1 was unvaccinated, and none had received a booster. Our thoughts are with their families and loved ones today. So, and out of respect for the families, I won't say anything more clinically about these patients. I do need to point out that because the virus is widespread, because we have widespread vaccination in the community, and because many of these patients, such as these, have complex medical conditions, it's sometimes difficult to work out if an individual patient has died from or with COVID, or to what extent the virus has played a part in their death. So from now on, our reporting we will simply report the deaths that are deaths in individuals who have had a positive COVID test around the time of their death. So we won't wait for further information from the coroner. We will just simply report any death that occurs in a patient who has had a positive COVID test around the time of their death. This brings us into line with how other states are reporting these cases. And as I say, sometimes it is very difficult to work out with patients with such complex medical conditions exactly what role the virus may or may not have had to play in their death. But this is how we were reporting them going forward. Okay, in terms of the hospitals, there are 26 patients in hospital ICUs at the moment, 10 of them ventilated. Interestingly, that's a fall from 30 yesterday. There are 530 cases in hospital, which is just a slight rise from 530 ward patients in hospital. Just a slight rise from yesterday, from 525. So 530 ward patients and 26 inpatient intensive care patients in hospital at the moment. So it's not a great deal of difference since yesterday, but I think we shouldn't read too much into changes on a day-to-day basis. We need to look at trends. There were 33,849 tests performed yesterday by Queensland facilities. As of 11th of January, vaccination coverage was 91.33% of the 16-plus population having 1 dose and 88.18% having 2 doses. There were 5,944 children aged 5 to 11 who received their first dose of vaccination at Queensland clinics yesterday, and 18,958 children have now received their first dose since the beginning of the program on Monday. I'll now hand over to the Health Minister. Thank you.
Thank you. So the changes to our border passes from 1 a.m. Saturday morning reflects the changing nature of the cases across Australia. It was important throughout 2021 that we control those people coming from hotspots and have restrictions around that. That is becoming less important by the day because this virus could be in any jurisdiction with anyone travelling, whether they are coming from a hotspot or not. So we don't want to spend our time looking at whether we need to be declaring and changing hotspots. We should assume that anyone travelling around Australia domestically could have the virus. And so it is a lot less important to worry about where people are coming from around Australia, and much more importantly, about where they're going. And that is why our restrictions around who can access certain venues and events remain, because we are still wanting to make sure that only fully vaccinated people are entering those venues and those events that are more likely to see fast transmission happening than where those people have travelled from around Australia. This will also alleviate many pressures across the police, who have done an incredible job with our borders. But now is the time to shift our focus to about where people are going, not where they're coming from. We are maintaining the international arrangements until we hit 90%, because we'll also over the next few days be looking at airline crew and maritime crew to look at what arrangements should occur for them, particularly around unvaccinated versus vaccinated. The only other thing I want to say is I've seen reports overnight from the Nurses Professional Association of Queensland, who have put out statements on social media saying they welcome the government's decision to allow unvaccinated health workers back into the workforce. I want to make this very clear. That is not correct. We are not planning, nor are we welcoming back unvaccinated health workers into the health system at all. And I hope that the MPAQ immediately clarify that statement that they're putting on social media. Unvaccinated staff are not able to come in and work in our hospitals. The only staff unvaccinated who will be allowed back into our HHSs but still not allowed to work in clinical settings are those who have been granted exemptions, in which there are very few, and there are those who are seeking exemptions currently, but those people are not allowed to work in the workplace unvaccinated. So I just want to make that very clear, because we want to make sure that we are supporting all of the staff who have gone out and got vaccinated, who have done the right thing, and also to send a message to our patients and to visitors that they are coming into environments that are as safe as we possibly can make them, by ensuring that the staff that are looking after them are fully vaccinated.
Thank you. Good morning, everyone. I welcome this announcement today. Since the establishment of the first border checkpoint in March 2020, this has been a significant operation for the Queensland Police Service to protect the community initially for the elimination of COVID-19, but more recently in slowing the spread. A sincere thank you to the community for their compliance and their patience in working with us over this time to ensure we had the proper safeguards in place to keep our community safe. Most importantly, and has been said a number of times, can I say a sincere thank you to all members of the Queensland Police Service, and also our partner agencies who have been working so hard on border operations over the past nearly 2 years. Protecting our borders has been incredibly important in preventing the spread of COVID-19. The evidence clearly shows you that when we shut the borders, we actually shut the spread. We slowed the spread down and shut it. While it has been a challenge, I am very grateful the way that the organisation has adapted to that and has prioritised that very important part of policing. This change from 1 a.m. on Saturday will enable us to reprioritise, get back to business as usual, and make sure now that we prepare for the peak over the next couple of weeks. Just to give you some stats to show you the sheer volume of what has been done on the borders in the past 2 years, I think is incredibly important. 3.3 million online border pass declarations. At the road borders, vehicles subject to confirmation checks, 3.68 million. Vehicles turned around at the border, 35,902. Persons directed into quarantine from the border, 20,247. At the domestic air borders, flights met by police, 29,336. Passengers subjected to confirmation checks, 1.8 million. Persons refused entry domestically, 4,452. International flights, we met 4,112. Passengers that were processed, 117,182. And from our domestic flights directed into quarantine, 64,466. Finally, I wanted to say a big thank you to the community who cooperated with us through what was a strategy of compassion, communication and compliance. It truly was a success, with police and community working together. During that period of time, we have issued 4,244 infringement notices. Notice to appear or arrests, 637, and handed out 15,000 masks, and that really is a gross underestimation. I would say it's probably 2-3 times that, because it's not always recorded on the system. So once again, I welcome the announcement. I say a sincere thank you to all members of the QPS for an amazing, amazing piece of work, an amazing operation over 2 years. And we look forward to obviously getting back to BAU and getting ready for that peak over the next couple of weeks. Thank you.
This is by far the most significant, I would say, decision that you've made in the 2 years that we've had here. How much of a relief is it as Premier of Queensland to make such a huge decision?
Look, it's a big decision, but it's a decision that's needed as we reach the peak of this Omicron wave. And operationally, the police are needed at the front line, and they have done an absolutely superb job. And we are so close to that 90% that I'm happy to bring forward that decision for 1 a.m. Saturday.
Was it difficult, Premier, to make?
Look, we had the advice of the Chief Health Officer, and Queenslanders know we always take on that advice. The Police Commissioner had also spoken to me about operational considerations as we head towards this peak. It's the right decision. It's also going to mean that there's going to be a lot more greater ability now for those people in northern New South Wales and the southern part of our Gold Coast to actually reunite. We know it's been very tough on those border communities, so I thank them for their patience during this time. And the other factor that played into this decision was the fact that the Gold Coast has now reached 90% first rate of vaccination. But the Gold Coast people should think also long and hard too about, if you have not been vaccinated, to go and get vaccinated.
On the Gold Coast, Premier,
Yeah.
the Mayor, Mr Tate, has taken it upon himself to step outside his territory and directly order the Council rapid antigen test kits from Korea. Is that ideal?
Look, he can if he wants to. He'd have to make sure that they've got a TARGI approval. But the Queensland Government and the Federal Government are procuring rapid antigen tests. This is going to be a hot topic of discussion today at National Cabinet. And what that does is, he might need that for his own council workers, so I completely understand that.
Retailers are claiming too that when they go to order rapid test kits for their shelves, they're told by the suppliers that governments are getting priority. Is that the way it should be?
I think governments know exactly where they need to be, especially the ones that we are ordering are going to, especially to people that are close contacts, and they can get freely available at our testing centres. And I know that the federal government is procuring them, especially for our seniors. So, look, at the moment the whole world is after rapid antigen tests, and the Queensland Government and I know the federal government are trying to procure as much as possible, as are other states.
The requisitioning, they are requisitioning, and we've got quite a few leaders actually, so the federal government requisitioning orders that people put in supplies.
Yeah, the federal government and state governments need these rapid antigen tests. We've got to keep the freights moving, we've got to keep our workforce operating, we've got to make sure that the public are able to get confirmation that they have COVID as well. Everybody is in need of supplies.
How does it work legally to override existing orders to prioritise?
Look, I don't have those answers. You'd have to ask the federal government.
The waiting for the international arrivals to get to 90%.
Look, it's probably just going to be to the end of next week. Stage 1, domestic borders, freedom of movement domestically. Stage 2, international, which should be the end of next week.
Do you think that it's easier to wait for that 90%, or is there a health
That was part of our roadmap, but now, at the moment, the need is for our domestic borders to be open so our police can return to the front line.
Premier National Cabinet, Mr. Bexar, obviously.
Yes.
Obviously, the Prime Minister is going to talk about a plan with schools. If he's not on board with the schools closing, extending that schools returning, you were looking for a national plan. Does that mean you'll just implement a Queensland plan moving forward?
We've announced our plan. I think what we'll be talking about more at National Cabinet is the framework for if there is an outbreak in a school, what are the procedures that are going to be putting in place. I think that's what people are looking for, to have a national framework for that.
Premier, I know you have to leave soon, so I just wanted to ask you on the matter of the deaf and or little girl, the parent
Sure.
buying insulin. What can you tell us about that?
Look, I can't comment because, unfortunately, well, it's before the courts at the moment, but can I just say that is an absolute tragedy, you know, a young child losing their life when care should have and could have been sought.
But we've been told that she was known to child safety. Surely you can...
I can't comment.
She's dead now,
No, I can't. That's not correct, Lexi. So, no, it's a matter before, it'll go before the courts. And I'm not going to prejudice any of those court proceedings, but it is an absolute tragedy. Absolutely.
Do you support a further change to the close contact rules to enable more workers to get back into work, so supply chain and things like that?
Look, we announced, I think you saw New South Wales and Queensland were one of the first, we were the first states to announce, I think it was on the same day, our essential workers categories. Ours was very broad. We may be adding to that today out of National Cabinet. But ours are very broad, and you know it's in limited circumstances where a person is asymptomatic within the household. Do you know what I mean? So it is about keeping the freights going, making sure that the groceries are getting to where they need to be. It is about logistics and making sure that people still get to their food supplies and essential supplies as well. So look, I'll have those conversations, and I'll let the Prime Minister comment more about that after National Cabinet.
I think they need to be in Queensland. The shelves that we see that are bare in some supermarkets, is that something we're just going to have to grin and bear for a while this wave happens? It's
a national issue, and as we know, the prediction is that it's going to be a short, sharp wave. So hopefully, it is just going to be those 4 to 6 weeks. But we need to get the freight moving. And I know that the Prime Minister's been speaking with some of the companies about that, and the State Development Department has also been speaking to our companies here in Queensland.
What rule changes will come into effect when we hit that 90% double vaccination rate? Will the unvaccinated, for example, be allowed to go back into pubs?
No, they won't. Okay. Yep. Thank you. If people don't mind, I'll go to National Cabinet and I'll leave the Health Minister here. Thank you. Thank you.
Health Minister, is it true that there's 20,000 rapid antigen tests that were hijacked by the federal government that were meant for Queensland rail workers? Are you aware of that? Apparently Minister Bailey was... No,
I'm not aware of that at all. We've been getting our orders. We've had 409,888 we've been able to procure and have been distributed so far across our HHSs and also our testing sites. We handed out 17,619 tests to individuals at those sites yesterday. So, look, we're slowly getting them. I heard the question from Jack about government being able to secure them from the private sector. I remind people last week we were supposed to get 500,000 from a supplier and they only gave us 150,000. So I think the other 350 went off to private sector. So, we'll work with the suppliers of all of these, but we want to get, as much as we can, as quickly as we can. We need to support our health workers and make sure they're getting access to regular tests as well, but also those free tests that we promised. I'm not aware of any that the government has taken off us. No.
Is you concerned that there could be a knock-on effect? The doctor's been advising people with mild symptoms to basically self-diagnose if they can in the absence of the RAT test and take Panadol. Are you concerned that Paracetamol, for example, could be cleaned out of shelves the same way we've seen tank buying, stockpiling?
Yeah, look, I am a bit of I am a bit concerned about that, and I am hearing stories already that shelves are being cleared out of these items, and I'm sure supermarkets and pharmacies are probably controlling the amount that people are buying now because of that. I just ask people to be sensible. You know, you don't need to stockpile boxes and boxes. Think about everyone else who's coming in who might be unwell, who need that as well. You know, it's a bit like toilet paper. You don't need to stock up for 6 months. You know, just be sensible about this.
And help the retailers. Is there anything you do by way of regulation to prevent that shortage from happening if that's the last option in the absence of testing that's going to confirm
look, the sector, as they have before managed to regulate themselves, the retail sector has put limits on buying the number of items when we saw that people were you know, stocking up on certain things. So I'm sure they'll do that again if they see that there is demand outstripping supply at the moment. I hope that doesn't happen. And I will say that people who have symptoms are still entitled to come forward and get a PCR test if they can't get access to a RAT test. Remember, we said if you can get access to a RAT test, you can test yourself at home. But that doesn't mean if you have symptoms and you think you have COVID and you can't get access to a RAT test, you can come forward for a PCR test. People just need to understand in doing that there may be waits and there may be long waits. But I would never say to someone that you can't come forward and get tested at this point in time.
Mr. Business owners, there's some reports out to suggest that 1 in 5 are really struggling or closed at the moment. I know that we talk about this quite regularly. If we are starting to get this supply chain of rapid antigen tests, will the government do 2 things? 1, maybe look at a support package, or 2, perhaps let businesses sort of push in line to get hold of some of these tests so they can get their staff back to work?
Look, the demand's all over the place. I mean, to start picking and choosing, yeah, I think the Commonwealth has a role to play here as far as supporting industry getting access to rapid antigen tests for their own staff, especially critical essential workers, support employers to get access to that. But you know, we, as a government, have a commitment to ensure that we have sufficient tests for our own public health staff and frontline staff, and also, and I know we've actually redistributed some of our supply to police because they needed it, and we want to make sure that they can get access to that. We've also committed to handing out the free kits at our lines for day 6. You know, and also particularly vulnerable people who we think shouldn't be standing in those lines for long periods of time. So I think it's difficult, you know, and I think the Commonwealth has a role to play. As far as financial support, can I say this? It was the Commonwealth who said all support, all financial support stops at the 80% mark for across the country. Also, we have done the Commonwealth a huge benefit in the way Queensland has managed the virus. Because since June last year, the Commonwealth has provided $252 million in COVID disaster payments to Queensland. New South Wales and Victoria combined, they have provided $11 billion. $11 billion versus 252. I think in New South Wales it's over $7 billion. I think in Victoria it might be $4 billion or the reverse. That's billions of dollars going to New South Wales and Victoria. We have saved the Commonwealth billions of dollars because of the way we've managed the virus. So if there's financial support to be given, I think, you know, Queensland's deserving of it because we have certainly saved the Commonwealth a lot of money.
So when is the Wellcamp quarantine facility going to open?
It's certainly on track, and I have no doubt the Deputy Premier will give an update on that shortly.
It's supposed to open mid-January. Why is it still not open yet? Is it going to the next week or so?
As I say, I'll leave it to the Deputy Premier to give an update on where Wellcamp's at.
Can you just clarify for us how many tests yesterday? You said you thought there was 1 million coming this next week, and then Health Week you told us later 4 million January 21.
Yeah, so I think looking at the data again yesterday, I think it's 1 million is being received from the Commonwealth. I believe the 14th, so I think it's due tomorrow. 500,000 of those are the point of care tests. So we have to look at how we use them because we don't believe that they're going to significantly assist us. In fact, could create further impacts as far as waiting times at our public testing clinics. So we've just got only about half of those are going to assist in alleviating waiting times at our testing clinics. Yes, so I believe, I don't have the timing of that, but I know we're due to get this $1 million on the 14th. Sorry.
With respect to the international border, is there nothing stopping people from flying internationally into Sydney and then just coming through the border into Queensland?
Look, we're talking about a matter of days, but look, the reason why we can't control what the other states are doing, and we know trying to put in place just a border pass just for international arrivals coming from other jurisdictions is extremely complex to try to set up for literally only a week or a bit. So we've chosen not to do that. But the reason why we're still keeping it in, and we need time to think about this, is our international arrivals are the ones who are going to bring in new variants. If we are going to see a change, we're dealing with Omicron now. Over 90% of the positive cases, as I understand, are Omicron now. But we do still have to look very carefully at international arrivals, and particularly unvaccinated international arrivals, because that's where the new variants will come from. And I'm sure everyone understands that we need to protect us from that as much as we can if there are new ones that evolve around the world. So we just need a few more days, and we need to look at the airline crew and the maritime to make sure we get the settings right.
Dr. Gerard, can we just ask about the 6 deaths?
Sorry.
People that were included in your yesterday numbers in the hospitalised or in ICU, or are these, in essence, surprise cases?
I can't actually answer precisely. I know 1 or 2 of them were in hospital. I know that there were 3 in residential aged care, and I'm not sure about the other. So,
CHO, what's your take on the availability of paracetamol in Queensland at the moment? Are you concerned that it's flying off the shelves unduly?
well, I'm somewhat concerned, but remember that paracetamol really is just to treat the symptoms of the infection. It doesn't actually do anything to the course of the infection. So, yes, it's unpleasant.
Could get a rat test if they had symptoms to take a Panadol.
Sure, because it helps their symptoms. And yes, it'd be nice. It would be good if the retailers could self-regulate and restrict consumption or purchase of paracetamol if possible.
Figures on the number of rat tests sold outside of government handouts?
I don't believe I don't have that data.
Is there a percentage roughly?
We don't have that data.
No, don't have that
The number
data.
of cases, like 14,000 today, that's a significant drop from yesterday. Is
Yeah.
that further evidence of people accepting their life?
I don't know that we can look at. We have to look at trends over time. That could be one of the explanations. Sure, lack of access to rat tests, people just accepting that they've had symptoms. That's possible too. As I've said before, I think the most useful data to look at now, going forward, and this is always the way with epidemics, is hospitalisation rates. That's why I tend to focus on those more than the testing rates. And at the moment, interestingly, our hospitalisation rates are quite stable, but we need to look for trends over days and weeks rather than individual days. But it is kind of interesting that they've stabilised in the last day or two.
The CEO of Pfizer did an interview yesterday saying that the 2 doses provided only limited protection against Omicron. He's obviously encouraging a third, but talking about a fourth booster and also an Omicron separate variant vaccine being released in March. So what are your thoughts?
Well, okay, so first of all, if we can talk about boosters, the evidence is increasingly strong that the booster is critical in preventing hospitalisations particularly. 2 doses seem to prevent, 2 doses do reduce the incidence of severe disease, but the booster significantly reduces your chances of being hospitalised over and above the 2 doses, and we have evidence of that as well. About an Omicron, it's a bit speculative to talk about an Omicron vaccine at this stage.
Commissioner, we can't see the smile from behind the mask. It must be huge.
I can see it in the eyes.
Finally, you get your officers back. It's been.
I was trying not to reveal the smile, but I will.
It's been exhausting 2 years for the force. You must be just elated to have your officers back.
I am elated. It has been exhausting. I travel a lot to speak to my staff. And look, everyone who's been on the front line of the last 2 years, I think, are exhausted. And we accept that. But we're all in this together, and I think, all of us, whether it be police or health, are just so extraordinarily proud of what we've achieved. It's because of this, because of what we've achieved, that we've put ourselves in such a good position. And I cannot stop congratulating my staff on what they've done in 2 years.
How many officers, I know this is probably a tough one off the top, I remember in New South Wales, Mick Fuller saying that 17 million times that officers would rotate through or something. It was ridiculous. Do you know this kind of number of times your officers have had to go through?
Oh, it would be in the hundreds and thousands, if not millions, because it's done over rosters, it's done over weeks, it's done over years, it's done in different areas. Interestingly, I was on the Gold Coast last week and I spoke to a police officer who'd worked in every part of the pandemic response. They had been on the borders, in quarantine, on the international side as well as the domestic arrivals, every aspect of it. And they were quite proud that they had put so much effort into, obviously, the response. So, once again, no, I can't take the smile off my face, but a sincere thank you to all of those officers out there. What a tremendous response.
It's probably got a big dent in the budget, no doubt. Has it stymied your ability to, secure assets, buy things,
So we went to government and asked for additional funding. Obviously, a lot of this is done with additional hours and on overtime. So certainly that was granted, thankfully. It does affect budget, but it has been, obviously, additional budget has been given to deal with this.
the number of hours that have been put on?
I'll actually get that to you because there's shifts and hours, and it's, if not into the millions, it's definitely into the hundreds and thousands. But I've got to say, once again, to the QPS, to all of our partner agencies, well done, sincere thank you. We are here in a safe environment today because of what was achieved in the last 2 years.
I'd just like to make one comment about the border restrictions, and that is that the border restrictions have served their purpose, which is to allow every Queenslander's access to a vaccine. And that was the purpose of the border restrictions, and they have achieved that. Now, every Queenslander has had access to the vaccine, and now the virus, as always, as expected, is spreading through Queensland, but with a vaccinated population. So the job has been done, and these borders are no longer required, and that was my recommendation to the Premier early today.
Is the absolute earliest that we could have opened the borders again?
Oh, we've been discussing this for a while with government. I've been discussing this with my interstate colleagues, but the border restrictions have done their job.
Thank you.
Thanks, everyone.